A silent threat. 12 signs that could indicate breast cancer. Breast cancer, medically known as mammary carcinoma, is one of the most common cancers affecting women worldwide. Despite significant advancements in treatment and detection, breast cancer remains a major health concern due to its ability to develop with few early symptoms. This cancer originates in the breast tissue, primarily affecting the inner lining of milk ducts or the lobules that supply the ducts with milk. The key to combating breast cancer is early detection, which significantly improves the chances of successful treatment. However, early signs of breast cancer can be subtle and easily missed. Symptoms can range from a new lump in the breast or underarm to changes in breast size or shape. Awareness and understanding of these signs are crucial for early intervention. Risk factors for breast cancer include gender, age, genetic mutations, like BRCA1 and BRCA2, family history, personal history of breast cancer, radiation exposure, and certain lifestyle factors. Despite these known risks, breast cancer can occur in anyone, underscoring the importance of regular self-examinations and screenings. Breast cancer can manifest in various ways, and not all breast cancers present the same symptoms. Some people may not experience any symptoms at all, which is why screening and regular checkups are so important. Regular mammograms, the primary screening tool for breast cancer, can often detect tumors that are too small to be felt. To address this critical health issue, I will outline the top 12 signs of breast cancer in today's video, empowering you to recognize and take action against this silent threat. Firstly, a new lump or mass in the breast or underarm is a primary sign of breast cancer. These lumps are typically painless, hard, and have irregular edges, but they can also be tender, soft, or rounded. It's crucial to understand that not all breast lumps are cancerous, but any new, persistent lump or change in breast tissue should be thoroughly evaluated by a healthcare professional. Regular self-examinations can aid in early detection of these changes. Secondly, swelling of part or all of the breast, even without a noticeable lump, can indicate breast cancer. This swelling might be accompanied by changes in the skin texture or an enlargement of pores in the breast skin, often likened to the texture of an orange peel. Such changes can result from the tumor affecting lymphatic drainage and causing fluid buildup, altering the appearance and feel of the breast. Thirdly, skin irritation or dimpling, sometimes described as resembling the skin of an orange, is a potential sign of breast cancer. This texture change is often due to cancer cells blocking lymph vessels or channels in the skin, leading to fluid accumulation and changes in the skin's texture. This symptom should not be overlooked, as it can be an early indication of inflammatory breast cancer, a particularly aggressive form of the disease. Fourthly, breast or nipple pain can be a symptom of breast cancer. While breast pain is common in many benign conditions, persistent or localized pain in the breast or nipple area, particularly if it's a new occurrence, should be evaluated. This pain might be continuous or it may come and go, but any new, unexplained breast pain warrants medical attention. Fifth, nipple retraction or inversion, where the nipple turns inward, is often a sign of breast cancer. This change can occur when the tumor is pulling the nipple tissue inwards, and can be especially noticeable for women who haven't previously had inverted nipples. Nipple inversion can also be accompanied by other changes in the nipple, such as unusual pain or sensitivity. Sixth, redness, scaliness, or thickening of the nipple or breast skin can be an early warning sign of breast cancer. These symptoms might resemble skin conditions like eczema but are actually due to changes in the skin cells caused by breast cancer. These changes in the skin's appearance or texture are particularly significant if they are persistent and localized to one area. 7th, nipple discharge, especially if it is clear, bloody, or occurs in only one breast, is a potential sign of breast cancer. While nipple discharge can be due to various benign breast conditions, any new, unexplained discharge, particularly if accompanied by other symptoms, should be promptly evaluated by a healthcare professional. This is particularly crucial if the discharge occurs without squeezing the nipple or if it's associated with a lump. 8th, a change in the size or shape of the breast can be a symptom of breast cancer. These changes may occur gradually and can be due to the tumor growing inside the breast or alterations in the breast tissue caused by cancer. Any asymmetry or change in the contour of the breasts, particularly if it is only on one side, should be brought to the attention of a healthcare provider. 9th, changes in the appearance of one or both nipples, such as becoming more pronounced, appearing altered in shape or position, can be indicative of underlying changes due to breast cancer. These changes can happen subtly and may include alterations in the direction the nipple points or differences in the nipple's texture. Such changes, especially when combined with other symptoms, should not be ignored. 10th, a newly inverted nipple, where the nipple, which normally sticks out, begins to pull inward, should be evaluated. While some individuals naturally have inverted nipples, a nipple that becomes inverted suddenly or over a short period can be a sign of breast cancer. This change can be a response to changes happening deep within the breast tissue, potentially due to the growth of a tumor. 11th, peeling, scaling, or flaking of the skin on the breast or nipple can be an alarming sign of breast cancer. These changes can mimic skin conditions like eczema but are caused by changes in the skin cells due to breast cancer. Any such changes in the skin of the breast or nipple, especially if they persist over time or are localized to a specific area, should be examined by a healthcare professional. Lastly, thickening or swelling of part of the breast, even in the absence of a distinct lump, can indicate the presence of breast cancer. This symptom may be due to a deep-seated tumor affecting the breast tissue. It can manifest as a localized area of increased density in the breast, and might be detected through self-examination or a clinical breast exam. If you notice these symptoms, it's important to consult a healthcare professional and request a mammogram. A mammogram is an X-ray of the breast that is currently the most effective method for early detection of breast cancer. It can identify tumors that are too small to be felt and can detect early signs of cancerous changes in the breast tissue. Breast cancer is a significant health concern. In the United States, it's estimated that about 1 in 8 women will develop invasive breast cancer over the course of her lifetime. Despite its prevalence, advances in screening and treatment have improved survival rates significantly. Early detection through regular mammograms, self-exams, and clinical breast exams is key to successful treatment. While breast cancer typically does not resolve on its own, there are effective treatments available. These include surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. The type of treatment depends on the stage and type of breast cancer, as well as the patient's overall health and personal preferences. To address breast cancer, let's explore 8 lifestyle modifications that can support overall health and potentially reduce risk. Firstly, maintaining a healthy weight is crucial for reducing the risk of breast cancer, particularly after menopause. Obesity has been linked to an increased risk of developing breast cancer, largely due to higher estrogen levels in overweight women. Adopting a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, along with consistent physical activity, can aid in weight management. This approach not only helps in maintaining a healthy weight but also contributes to overall health and well-being. Secondly, Incorporating a diet rich in fruits and vegetables is recommended to lower breast cancer risk. These foods are abundant in essential nutrients, vitamins, and antioxidants that help protect against cancer. Particularly, fruits and vegetables rich in carotenoids have been associated with a reduced risk of breast cancer. Striving for a diverse diet that includes a wide range of colorful fruits and vegetables can provide the necessary nutrients and antioxidants to help reduce cancer risk. Thirdly, limiting alcohol intake is important in reducing the risk of breast cancer. Alcohol consumption increases the risk of breast cancer, and this risk escalates with the amount of alcohol consumed. Reducing alcohol consumption to no more than 1 drink per day, or avoiding it altogether, can significantly decrease the risk. This step is crucial as even small amounts of alcohol have been linked to an increased risk of breast cancer. Fourth, engaging in regular physical activity is crucial for breast cancer prevention. Exercise helps in maintaining a healthy weight and has been shown to reduce the risk of breast cancer. Aiming for at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week, along with strength training exercises, can be beneficial. Regular physical activity not only lowers the risk of breast cancer but also improves overall health and quality of life. Fifth, breastfeeding offers protective benefits against breast cancer. The longer a woman breastfeeds, the greater the protective effect against breast cancer. Breastfeeding for a total of 1 year or more, cumulatively for all children, has been shown to lower the risk. Besides reducing the risk of breast cancer, breastfeeding also offers numerous health benefits for the child. Sixth, careful consideration of hormone replacement therapy, HRT, is important. Some forms of HRT, particularly those combining estrogen and progesterone, have been linked to an increased risk of breast cancer. If HRT is necessary for menopause symptoms, it should be used at the lowest effective dose for the shortest possible time. Discussing the risks and benefits of HRT with a healthcare provider is essential for making an informed decision. Seventh, minimizing exposure to radiation and environmental pollution can contribute to lowering breast cancer risk. Medical imaging methods like CT scans that use high doses of radiation can increase the risk of breast cancer. Limiting exposure to these imaging methods when possible, and being mindful of environmental pollutants and endocrine-disrupting chemicals, can reduce risk. Avoiding unnecessary radiation exposure and being aware of environmental risks are proactive steps in breast cancer prevention. Lastly, considering genetic counseling and testing is important for women with a strong family history of breast or ovarian cancer. Genetic mutations such as BRCA1 or BRCA2 significantly increase the risk of breast cancer. Genetic counseling can provide valuable information about personal risk and discuss the benefits and implications of genetic testing. This is particularly important for individuals with a family history that suggests a genetic predisposition to breast cancer. These lifestyle changes, while not foolproof, can significantly reduce the risk of breast cancer and enhance overall health. Each modification is a step towards a healthier lifestyle, reducing risk, and promoting well-being. In summary, breast cancer is a major health concern, being one of the most common cancers affecting women globally. Early detection through self-exams, regular clinical exams, and mammograms is crucial for successful treatment. While breast cancer symptoms can be subtle, awareness of changes such as lumps, skin alterations, or nipple discharge is key to early diagnosis. Breast cancer represents a significant portion of cancer diagnoses among women in the United States, with about 1 in 8 women developing invasive breast cancer during their lifetime. However, advances in breast cancer research, screening, and treatment have significantly improved survival rates. Regular screening, especially for those at higher risk due to family history or genetic factors, is vital. While breast cancer generally does not resolve on its own, there are effective treatments available, including surgery, chemotherapy, radiation therapy, hormone therapy, and targeted therapy. The choice of treatment depends on various factors, including the type and stage of cancer, and the patient's overall health. Historically, treatment options for breast cancer were limited, and outcomes were often poor. But with advances in medical technology, particularly in the areas of early detection and targeted therapies, survival rates have improved dramatically. Today, many breast cancer patients have a good prognosis, thanks to these advancements. Preventive measures and lifestyle modifications play a crucial role in reducing the risk of breast cancer. These include maintaining a healthy weight, eating a balanced diet rich in fruits and vegetables, limiting alcohol consumption, engaging in regular physical activity, breastfeeding, being cautious with hormone replacement therapy, minimizing exposure to radiation and environmental pollutants, and considering genetic counseling for those at high risk. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.